Hi, this is Brianna Regan, and today we're going to be talking about Cryptococcus. So before we begin, let's go over some of the things that we're going to talk about today. So what is Cryptococcus? How may it present? What causes the disease? Who is susceptible? The history within the U.S. and where it's proliferating now? And what are the treatments and potential negative effects of that treatment? So, Cryptococcus is a pulmonary or disseminated infection acquired by encapsulated yeast, Cryptococcus neoformans, and that's going to be the most common form that we see, whereas Cryptococcus gatii is actually from eucalyptus trees. So, the more common form that we're going to see is from bird droppings, specifically in urban areas, we're going to see it from pigeons. And again, as I mentioned, it's an encapsulated yeast. So right here, we just have a nice little graph of all of the pathogens that we're going to be studying in our course throughout the semester. So it's going to fit under this category right here, specifically that unicellular yeast, and you can see it right under there. So let's move on to the disease itself. So I just wanted to highlight that this is not spread from person to person. This is spread from inhaling the yeast itself. So it's going to cause pneumonia-like illness. You're going to present with coughing, fever, and shortness of breath. And on this scan right here, we can see a lesion that's formed. So when this disease goes out of the respiratory tract, it's going to disseminate. So I've categorized these into two separate sections to make it a little bit easier to follow. So right here, we're going to have cutaneous cryptococcus. So these are going to be umbilicated lesions. They're going to be non-necrotizing and scattered throughout the entire body, as is highlighted here. We see the upper body of a trunk, and again, this is going to be over the entire body. So these lesions are going to have a slight divot form to them, and we have a nice example that you can observe right there. Additionally, we have meningoencephalitis. So this is going to be a central nervous system infection, and we can see a brain scan right here, and these are highlighting the intracranial lesions in red. We're also going to have swollen lymph nodes. We're going to have generalized respiratory tract, cutaneous lesions, which we've just mentioned right over here. They're going to present with fever, altered mental status, nuchal rigidity, so you're going to have soreness in the neck. You're going to present with vomiting, headache, and photophobia. So a little bit about the incubation time. So the most common form is completely unknown, whereas the lesser common form, we estimate from the time that you were exposed to the time that you develop symptoms is going to be 2 to 11 months. Moving on to a little bit more about this unicellular yeast. So it's going to have a large polysaccharide capsule, and this is going to be the basis for one of the diagnostic tests we will talk about in just a little bit. And then this polysaccharide capsule is also going to prevent phagocytosis. So how does this relate to gram staining? Gram staining is not particularly effective in this case. It's going to be hampered by the presence of a large gelatinous capsule. So they're going to stain either gram-positive or negative. What do we use instead? So we're going to use India ink. This is going to be a negative stain. As you can see down here, the individual cells themselves haven't necessarily been touched by the stain. It's the background that has turned a different color to make them more visible. So how do we use these for diagnostic testing? We're going to do microscopic examination. We can also culture tissue, body fluids, such as blood, cerebral spinal fluid, and sputum. So right here, we have the cryptococcal antigen test, which I said we would mention in just a second. So this can be performed on blood or cerebral spinal fluid. So let's scroll up a little bit. So this test uses the large polysaccharide capsule, which is going to be shed into the surrounding fluid, which is what we test for. And then lastly, we can do a lumbar puncture. And when we do this lumbar puncture, we're going to see evidence of lymphocytic pleocytosis of the cerebral spinal fluid. So this means that there's going to be white blood cells present, and specifically we're looking for lymphocytes in this case. So who can become sick from this? Healthy people primarily do not become sick. Many people become exposed, and one study showed that 70% of children in New York City have become exposed to this. Although I just do want to note that healthy people can become sick from either strain. Although again, it is very rare. So this is an opportunistic infection. It's primarily going to target people who are immunocompromised. So here are 3 examples of people that may be susceptible to this. So primarily HIV/AIDS. So we're going to have a very low CD4 count in this case. And AIDS is typically distinguished by having a CD4 count below 250. Transplant patients, on the other hand, are going to be given immunosuppressant drugs. And then also, idiopathic CD4 lymphopenia. Again, as the name indicates, you're going to have a low CD4 count, which is going to make you susceptible to this as well. So right here, just for some historical context within the US, we have some marches from the 1990s and 1980s. And then this is also in Washington, where there was quilts of names of people who had died from HIV/AIDS. So previously to the discovery of antiretroviral therapy, people were specifically susceptible to fungal and other opportunistic infections. And again, this is because of that low CD4 count. We can see in this graph right here. So this is representing the AIDS-related, this is going to be disseminated again. And I apologize for my poor handwriting. Disseminated streptococcus. And as we can see, there is a marked decrease that we can observe. And this is going to be primarily due to the introduction of those drugs. So early detection, and again, initiation of antiretroviral therapy. So this is going to mitigate the severe decline in one's immune capacity. So it's going to lessen your susceptibility to these funguses and infections. One study showed that, one study's findings were that streptococcus in AIDS patients within the U.S. decreased by approximately 90% in the 1990s, which we can see again on this graph. So this is some statistics from 2017. An estimated 220,000 cases still occur worldwide each year. So we again can see how important the access to all of these drugs are. And just to give you something to compare these numbers to, in sub-Saharan Africa, it kills more people annually than tuberculosis. So let's talk a little bit about treatment and prevention. We're going to use these 3 drugs. And this third one here is going to be specifically for people that are suffering from HIV. And this treatment is going to range anywhere from weeks to a lifetime. So let's talk about a little bit about the effects of these drugs, some negative things that can happen. So for people with late-stage HIV, so again, their CD4 count is going to be anywhere less than 250. So let's say we begin treatment, and their CD4 raises to above 1,000. It sounds great, but their CD4 will immediately go to work and start flooding the brain. This is what we called immunoreconstitution inflammatory syndrome, which can also be abbreviated as IRIS. So when this happens, it seems counterintuitive, but we actually might prescribe an immunosuppressant drug. Something that can happen with this is we might even need to place a stent to relieve some of the pressure. So kidney infection and bone marrow suppression can also happen in people that are being treated, not specifically with AIDS, but with any of these drugs. Some of the recommendations that have been given. So for C. pneumoniformis, we're going to see it commonly be spread by bird droppings again. So we're just going to recommend that if you're immunocompromised, just stay away from birds and bird droppings. Not that you're necessarily running towards those anyway. And then for the lesser common, we actually have no formal recommendations. So let's just go over what we've covered today. So Cryptococcus is a fungal opportunistic fungal infection. It's found worldwide. So we learned some of the signs and symptoms of both pulmonary and disseminated Cryptococcus. This eukaryotic encapsulated yeast that has a thick peptoglycan wall. We learned about the healthy versus immunocompromised population, the rapid rise and decline within the U.S., and the parts of the world that are particularly struggling with management, the treatments and potential negative effects of those treatments on severely immunocompromised individuals. Right over here are my references, and